Hi, welcome back, guys. We are deep into our 2 months of winter here in the South, and like the rest of the country, cold weather can mean isolation and even feelings of depression. So here to help us navigate this tricky time is your MD bestie, Dr. Jaya McSharma.
Hello.
Hi.
Nice to see you. Happy New Year.
Happy New Year.
Yeah.
We're all sparkly because it's January, and we want to be happy.
Exactly. We want to be happy. We're busting out the phototherapy lights because seasonal affective disorder, nicknamed SAD appropriately, is a thing because what happens in the winter months is we get, well, first of all, the daylight savings isn't making anybody happier.
No, it's not.
It's not. But also, we're just outside less. The time change, of course, it's darker outside early, like you feel like it's lunch and then all of a sudden it's dark outside. So a lot of people can feel very low this time of year. And maybe sometimes it's not just the weather, maybe it's the time of year. You've lost a loved one or you have some family dysfunction that tends to be highlighted, you know, during Christmas and Thanksgiving, right?
There's always that post-Christmas blues kind of a thing. So you offer a mental health consult.
Yes. Okay. So I was thinking, I was like, how can we kick the year off right for people? What is it that people need? And I feel like we need to tend to our minds because we've just been through Christmas, like you said, the post-Christmas blues. So your MD Bestie is offering the mental health consult. So this is so cool. I've been on antidepressants myself. I've taken medicine, and really before the way that you approach it is trial and error. Like, okay, let's try Lexapro, let's try Zoloft, okay, let's increase the dose, okay, let's change medicine. And even though we did use data to guide those kind of decisions, now we have something that's completely like breakthrough technology. It's called GeneSight testing. So all you do is take a swab of your cheek, you mail it off to their center in Dallas, and based on your unique DNA, it tells you exactly what medicines are good for you, just like a stoplight, red, yellow, and green. And that's actually my report right up there. So if anybody wants to screenshot it and get up in my business, you can.
That is so interesting.
Isn't that so interesting?
Now, how does this change the game for wellness?
So basically, like if you are on a medication or have been on a medication, you can now look at this list and say, oh, this is a red for me. So this is not the best medication for me. So I actually had a patient who had been on Lexapro for years and years. It was in the red column for him. So we weaned him off of that, started him on a green column medication, and this is what he said: I have lived my life at a 7 or 8 with anxiety for the last 10 years. I feel normal for the first time in my adult life.
That's incredible.
I mean, what a gift, right?
Is a gift.
What a gift. And then it's a gift for doctors and providers too, because we don't just have to guess, okay, Lexapro works for most people in your situation. Now we know, based on your DNA, this is the medicine that works for you.
Well, it's fascinating. You know, you call this the invisible illness. It's still not taken seriously with a lot of physicians.
It's not. I mean, like, you know, if you have the flu, I know what to do. I'm going to call you in some Tamiflu, tell you not to come to work for 7 to 10 days, you'll be fine. When you're depressed or anxious, a lot of people are functional on that. So like I'm at work with you and maybe you're going through a hard time, but you push through because nobody can see inside your brain. Nobody can see how you're feeling. And so I do feel like a lot of doctors and providers, maybe because they aren't able to recognize when someone is anxious or depressed because people hide it so well, it is an invisible illness that can just go on for years without anybody taking it seriously.
And depression can often manifest itself in very physical ways.
Oh my gosh, yes. We call that psychosomatic conversion, you know, in the medical field. But basically, if you don't tend to your mind, it's going to show up in your body. So some people will develop chronic abdominal pain or joint pain, and it's really something that's going on with their mental health that needs to be addressed. So yeah, absolutely.
Well, it's really interesting because this time of year, if you do get a panel done, most people are hit a reset with their insurance as well.
Yes,
if you go get a panel done, it's about $350, but your consult is $199 for non-MD Bestie RX?
That's right. So if you're not currently a member of my concierge program, which you totally should be at YourMDBestie.com, you can still get the consult for $199. And if you are a member of my program, the consult is free. Hello.
That is amazing.
Yes.
For free.
Yeah,
for like
free. Yeah, we like free, right?
We do like free.
Yeah.
Well, this is so important. And if you are feeling any of these things, and maybe you just want to start the year off knowing what your plan is,
absolutely,
or having a plan for yourself, or trying to figure things out, this is definitely the way to go.
It's awesome. And also, I tell everyone, your DNA is not going to change in this lifetime. So you only have to take this test once, and you will always have the information for whatever doctor you go to. You will always have this information to fall back on. And remember, in older people, depression can present as dementia, pseudo dementia. So just tend to your mental health. I'm here for you. I believe you, and I know that mental health is important.
All right, your MD bestie, Dr. Jaya McSharma. We're going to take a break, come back. We'll talk more with Dr. Jaya when we come back.